Alcohol or drug addicts with job problems who are in denial about their addiction are often convinced that other problems cause their job performance shortcomings. Such employees are able to convince the supervisor that these other problems are primary. Here is a good understanding of how denial works. Addicts have a definition of addiction that excludes them. Addicts focus on symptoms of addiction that they do not have and use this information to avoid self-diagnosis. Addicts change their definition over time to exclude worsening symptoms. Denial is a defense mechanism that works hand in hand with myths and misconceptions about addiction. Denial is used to avoid awareness and is reinforced by others who are willing to participate in it. Depressants. Depressants are also called downers, sedatives, hypnotic drugs, minor tranquilizers, and anti-anxiety medications. They are grouped into two classes, barbiturates and benzodiazepines. Barbiturates are the more dangerous of the two, especially when mixed with alcohol. Both classes of drugs have alcohol-like effects depending on the dose. Absenteeism, reduced productivity, and increased accidents are associated with abuse of these drugs. Their impact on psychomotor skills is severe and makes them especially hazardous. Depressants produce feelings of euphoria, relaxed inhibitions, disorientation, and reduced motor coordination. Cannabis. Cannabis is marijuana, and its byproducts are hashish and hashish oil. Cannabis is usually smoked but can be eaten. Overdose of the drug will produce fatigue, paranoia, and possible psychosis. Withdrawal symptoms include insomnia, anxiety, hyperactivity, and decreased appetite. Workplace dangers include driving or occupational accidents, accidents from distorted time and space relationships, and impaired coordination. Other hazards include impaired motor skills and concentration. Cannabis is the second most used drug in the U.S. after alcohol. It is grown clandestinely nationwide. When smoked, the user feels high within minutes, peaking out in 10 to 30 minutes. Effects depend on the user's psychological state and THC strength. Low doses provide a feeling of well-being, relaxation, and a more vivid sense of sight, smell, taste, and hearing. Stronger doses may intensify reactions, shifting sensory imagery, rapidly fluctuating emotions, flights of fragmentary thoughts with disturbed associations, altered sense of self-identity, paranoia, illusion of heightened insight, and hallucinations. Frequently reported are hunger and an increased desire for sweets.